Hey, we have live Q&A today, meaning you ask questions, I share what I know. I don't always have all the answers, but I got some great questions this week and I wanted to dive in. We're going to talk tremor treatment. We're going to talk heart rate variability, assessment and how you use it in therapy. We're going to talk about cervical dystonia, treatment resources, and we're going to talk about brain bites. All of the things that you've been asking me about this week. Specifically, clinicians have reached out. And while we're live, if you have questions, feel free to put them in the comments here and I'll look through those as well. But if we haven't met, my name is Julie Hirschberg. I am a neurologic physical therapist, Team Neuro, that's what it says here. And McKenna, hi. I get so excited by the folks that join us every week. Thank you so much for being here. I am the owner and founder of Re+active Physical Therapy and Wellness. I am here in the Los Angeles area and do a lot of mentoring and teaching and education for other clinicians. So clinicians will reach out with questions, and this person reached out with the following. I was wondering if you had any ideas on how to treat upper limb tremor. My issue arises when we try to create an external focus for the client, and that automatically focuses on the upper limb. It does, and that's tricky, right? And this person's so creative. I tried bilateral handwork, catching a ball, tapping a balloon, but the tremor is actually worse. I've seen this too, so I just want to say, I'm there with you. Sometimes upper extremity activities make tremors worse. I also tried some breathing techniques while using upper limb as an external focus. If you have any ideas, please let me know. So first of all, thank you for asking the good question. Thank you for being the kind of therapist that wants to do even better for your patient. It's very clear you are an incredible soul and person that really cares. So I just want to thank you for that. And second, just say yes, when a person has upper extremity tremor, many of the upper extremity tasks bring visual focus and attentional focus to the limb. And those are the tasks that the person wants to get better at. So often we have to start away from that task. And not only that, we really need to see what's driving that tremor. So this is where I'll zoom out and what's the pie chart? What are the underlying components that might be contributing to the tremor? Things that I see commonly, and it sounds like maybe you were looking at this too, is autonomic. And you mentioned some breathing techniques. So autonomic regulation can worsen every type of tremor, by the way. Parkinsonian tremor, functional tremor, physiologic tremor, essential tremor, you name it. Autonomic dysregulation, increased sympathetic output usually worsens the tremor. So I like to assess it and then incorporate that into treatment. And the treatment does not have to involve the upper extremity whatsoever. And because I also got the great question about HRV, I'll talk about that in a moment, because I think that could be a really great treatment for tremor. I've used it. So autonomic, sensory. Sometimes the tremor is occurring because the person's not getting great sensory feedback from the limb. If you don't have good sensory feedback from your limb, your brain may cause tremoring, may cause abnormal movements because it's not getting the correct feedback. So you got to test it. I would test the sensation in the limb, and not just light touch and proprioception, but I might look at 2-point discrimination. I might look at kinesthesia. I might look at a sensory map, like a 9-grid testing. All of those. And I know for our Brain Bites members who are here, we have the whole how-to manual on all of those testing in our resource vault. So I would look at the sensation in the limb and see if there's an impairment there. And if there is, treat that. And again, I would not bring an attentional focus to the limb in that treatment. I might make it something totally unrelated. I'm just going to grab my door here. So the dogs don't join us because when they join us, they're like so loud and they're just so excited to be a part of the party that is happening here. So autonomic sensory. Now I might look at, then if I test sensation, I might treat it using different things like weighting, proprioceptive activities and weight-bearing activities for the limb. I might layer on. So by the way, if you're testing autonomic and you're testing sensory and you're finding deficits, I would layer on the treatment. Sometimes autonomic alone is not enough, but autonomic and sensory are. So autonomic sensory, the motor control, it sounds like you're already doing this using an external focus. It may need to be a very novel, very fun, maybe even silly task that is externally focused. And I would start away from the limb. And I wouldn't even attend to the limb. But so for me, that might be something like dancing or playing a game. And again, this would be very person specific. If it were me, we could play a ball toss. We could play a balloon toss, like you said. It sounded like that made things worse. So again, I might layer on. My guess is that if you look at autonomic and sensory, both of those are going to improve that person's tremor, and then I might layer the motor control on it, but don't use the hand. Do a leg test, do a body test, do a head task. Head tests are really fun. We have this really fun like headband basketball game. Super fun. And this would be a way to get some automatic movement without bringing the focus to the limb, because attention can drive tremor. The other pieces of the pie that you would want to look at are lifestyle, psychosocial, and physical impairments. And often what we see is there's little bits and pieces in all of those pieces of the pie. Usually one of them is the bigger piece. It's often a sensory or autonomic component that hasn't been looked at, but you can assess that and take that into treatment. So there you have it. Now, because the second question that came in was about heart rate variability, let me find this great question. Chris, I saw you hop on here. He's been looking at purchasing an HRV monitor, so a heart rate variability monitor with some recent savings. Wahoo. And by the way, these are coming down in prices. The leaf monitor or the puller monitor, how do you incorporate these into the session? Is it more feedback with breathing exercises in session, or are patients using these at home with exercise, 24-hour monitoring, etc.? Brilliant question, Chris. I love your dedication and your insight already onto this. I have my two monitors here because I was like, oh, I had not even worn the puller monitor yet. We use it at the clinic, but I had never worn it, so I wanted to wear it and see how it worked. This is the Leaf that Chris asked about. This is a portable EKG. It's on a strap. The strap has, you can kind of see them here. You wet them down and you put it on, it snaps in, you wear it around, and it can measure your heart rate and your heart rate variability. So heart rate variability, this is kind of connected to that first question. Heart rate variability is a direct window into the autonomic nervous system. So this is why Chris is asking, there's not a lot of ways that we can kind of directly peer into the brain and the nervous system and really understand what's going on. Heart rate variability is one of those ways. And there's a lot of ways to look at it. You could use your Apple Watch, you could use your Whoop, you could use your Oura Ring. There's been a few studies looking at how accurate some of that data is compared to EKG. And it does look like a chest strap monitor is the most accurate. Now I realize I'm actually wearing my chest strap monitor. So this is the Puller. It's similar to the Leaf. It's not a little portable EKG, but a similar type of reading. And it is going to give some of the same data with heart rate variability. So how do we use these? Right? So first thing that I recommend when you get one is to use it yourself. So you're getting feedback, you're getting some of the data, you're seeing how it changes with your exercise and sleep and activity. Highly recommend it. I feel like every single thing that I've used clinically, I try on myself. So that's what I recommend first. Cost-wise, the Polar, I have the Polar H10 monitor. I'm not affiliated with any of these brands, by the way. I got it on sale for about $80. That seems like a pretty good deal to me. Then I got a free app, and there's tons of different apps. The Elite HRV app is something that a lot of folks use, and that's what I have been using. So you can use the Elite HRV app. You can get a baseline of heart rate variability measurement, and you can also get heart rate measurement, and then you get a nice readout with it. So with both the Leaf and the Polar, you can get baseline heart rate and HRV. So I recommend you do it on yourself. The Leaf is more expensive. So I believe now, the last time I looked, which was just a couple of weeks ago, you could purchase this for $200. And then they have an app that, don't quote me on this, it's like $40 or $50 a month to use it. The difference with the Leaf is that it actually gives a vibrating biofeedback. This is why I have loved it, but it is, to me, a lot more expensive than the Polar H10. So, but I will tell you, I used this for about 3 months straight, and that biofeedback was incredible for me. So when I say biofeedback, what it does, you can set it for different levels and sensitivities, but it vibrates to say, hey, your heart rate variability is dipping. Let's practice something together, right? And for me, because I haven't had great interoception or awareness of what was going on in my autonomic nervous system, that was a game changer. It would take me through breathing exercises like in the midst of meetings or difficult conversations, and I was like, oh my gosh, this is incredible. So I loved that vibrating biofeedback. However, I think it's kind of pricey. So the Polar H10 with an Elite HRV app, it will give you feedback. So it'll take you through a resting activity. It'll give you feedback. That I have found, it doesn't, the Polar H10 doesn't vibrate. It doesn't have that capability. You can get feedback on the app. So I think you could use it in kind of a similar way. I like to have something vibrate and like be like, hey lady, like you are spiraling out of control, like please breathe, right? So that was really helpful for me, but I don't think everybody needs that. So how do we use it? So for both of them, we will use it in a session together to trial it. We usually do this first. So we'll put it on, we'll hook it up to the app, we'll just get a baseline HRV reading, see where a person is, and do that in a resting position. And then we'll look at different activities. So this is what I love about it, is I'm thinking about our first case with Tremor, right? This person was looking at breathing activities. Did they make it better or worse? What I would really care about is, does that actually change their heart rate variability? For some folks, we might do a breathing exercise and their heart rate variability actually gets worse. So that's not really, that's really good information, right? So then we know, okay, not that activity. Let's do something else. Let's try some rocking and swaying. Let's try some singing or humming. Let's try listening to music. Let's try some guided imagery. Let's try some progressive muscle relaxation. Every person's very different, and that HRV reading will show us, that was really helpful. And it may be, I'm going back to the Tremor, the person asking about that Berkshire Beach Tremor, it may be that when that person had to play a game, maybe that was really stressful because that's been challenging before with their tremor. And so their heart rate variability was dipping. So we actually need to do some other activities to bring that up first, for example. So I'll use it within a session, but I think heart rate variability is most helpful long-term. And this is right to the point of your question, Chris, when the person can use it at home. So the person gets an app, the person gets the leaf, they can use it at home and find things throughout the day that both increase or lower their heart rate variability. And by the way, I don't really use norms for it. I use the person as the norm. Does it increase? That's good. Does it decrease? Well, something's happening there. Maybe they didn't sleep well. Maybe they're dehydrated. Maybe they drank alcohol. Maybe it's part of their menstrual cycle. Many things influence heart rate variability, and you have to take that into consideration. Just because somebody's dips, it doesn't mean they're doing something wrong, right? It might just be what is happening for them neurophysiologically that day. So yes, then we have the person get it. We have them use it at home. I love heart rate monitoring as well, because we'll use that for a graded activity or graded exercise as well, particularly in POTS and dysautonomia. So I think I got your question, Chris. Very good question. Thank you so much. Somebody else asked me about cervical dystonia. So we've been talking a lot about dystonia. Our dystonia program director, Lincoln, has been putting together some really awesome stuff because we are starting an online class in our online wellness membership for people with dystonia. And this education class is going to be for people with cervical dystonia, with runner's dystonia, with musicians' dystonia, any type of dystonia. And it starts in 2 weeks. So we've been sharing a lot about that. We do physical therapy, occupational therapy, psychology. We do an integrated program for people with dystonia. Yes, we do it in person and we do it online. We can only provide that whole integrated program for people who are in California. Our licenses are restricted. However, we do have 2 PTs licensed in Florida and in Texas. So we are available for online services in those states. And we are able to provide some coaching, not therapy services, but coaching to people with dystonia in other states. What I forgot to say too is internationally, we can provide online services for PT and OT. So this person had asked if we can do Zoom therapy. Yes, we can. We can do Zoom therapy if you are in California or if you are international. We could do coaching with you if you're in another state. And we have a brand new dystonia class for you that you can join from anywhere in the world. So lots of options with Re+active if you have dystonia. And Camille, I'm in Canada. We see so many people from Canada. So yes, the best way, by the way, if you are international or interested in any of these services, is just go to our website at reactivept.com, fill out the application. We set up a consultation to see what might be a good fit for you. But we see people all the time from all over the world. And Chris says, thanks so much. They'll be very helpful for my patients with post-concussion. Yes, it will. I will say that might be where we use HRV monitoring the most, because the combo of HRV and heart rate, so that we can do some graded exercise, it is so helpful. Thanks so much for the comment. I see another question here. What are your thoughts on chiropractic adjustments for helping tremor by addressing nervous system with adjustments? So really good question. This is not my expertise. I am not a chiropractor. I do train to do manipulation and mobilization. I have never been the most comfortable doing manipulations myself. In the thoracic spine, not too bad, but I don't do them in the cervical spine. And I'll tell you why, because I've had patients who have ended up with a vertebral artery dissection from a chiropractic manipulation in the cervical spine. So that is not something I would do. But there are some studies looking at the neurophysiology of mobilization. So mobilization is different than manipulation. So manipulation is a high velocity movement, and that it can change some neurophysiology. So could that be a part of dystonia treatment? Absolutely. Is it the only thing? Usually not. What I find in dystonia, it's a complex picture, and the research has shown this as well. It's not usually related to just one thing or just one part of the nervous system, but just like I talked about with tremor, a whole pie chart of sensory, autonomic, motor control, lifestyle, psychosocial, and physical components that might contribute to dystonia. And now I realize you didn't even ask about dystonia. I'm so sorry, I misread that, or I combined it with the last question I had. You were asking about tremor, but similar thing. So some people find it helpful. And if it's helpful, I'm like, why not? Now, one thing I will say that I think is really helpful is to explore options for treatment that empower you to be able to manage it on your own. Because one of the things with tremor, especially functional tremor, is that there's a component of self-agency that is lost. Self-agency is that feeling or knowledge that I have control and autonomy. And it's been shown in studies looking at brain imaging that there are areas of the brain associated with self-agency that have skewed connections. It might be the best way to say it. So if we want to restore self-agency, being dependent on anything, so not just chiropractor, any therapist or any one person all of the time to be the source of relief for that would not help restore self-agency. So this is a little complex, but what I'm really saying is that you want to be engaged in treatment that empowers you to have some tools to help manage and control it yourself. So that was a long way to say that. I'm sorry. Denise, hello. I'm from Brazil and loving the updates on functional disorder. I'm wondering what the ideal approach to reduce tremors in patient with functional disorder. Well, perfect, Denise, because I just answered that question that somebody had sent me a message about of looking at that whole pie chart. So I'm so glad you joined us. And Leanne, F&D warrior from Australia. Oh, I'm so glad you're here. Thanks for joining. And Lauren saying I'm an F&D patient. Thank you for joining. And if you have F&D and you're from anywhere in the world, we have an online membership for you. And in fact, I just did 2 of our consults for that. We do for folks that join that membership, and they join an annual membership. Every 6 months, we do a wellness evaluation with them. And I did 2 today, and just incredible. One person is no longer having symptoms at all, and she's going back to work, and she can drive her kids again, and she is running. Like, this person has really regained control of her life through just 6 months in our membership. So if you're a person with F&D looking for something like that, you can check that out on our website as well. It's at reactivept.com/FND. Another great question: have you found the body braid helpful for people with functional tremors in the leg? Yes, I have. And so this would be another thing I would recommend. Whoopsie. I think my holder is a little loose here. Sorry about that. back to the tremor question, whether it's the legs or arm, that proprioceptive input that the body brain provides can be really helpful. And some folks find that they develop tremor because they do have some joint hypermobility and some impaired proprioception. And if the body brain can address that, it's great. Again, best thing to do is test it and treat it. We need to test the underlying components so that we can know if the treatment would be helpful. It's a brilliant question, really good question. Okay, I have other questions that were sent in here. Oh shoot, did I lose them? We have opened up our Brain Bytes community for clinicians this week. So I have got some really great questions about that. Let me pull this up here. So when is it is one of the biggest questions, and what is it? So I know we have a bunch of clinicians and patients that join me on these lives, but Brain Bytes is a group that we do for mentoring and education with other clinicians. It's physical therapists, it's occupational therapists, it's psychologists and other mental health care providers, it's chiropractors, it's yoga therapists, it's fitness therapists, all with this common mission. They really care about complex neurology, complex chronic disease, and going deeper and learning and supporting each other in that. We open our doors. It's the last time this year that we are opening our doors, and they actually close tomorrow night. So we let in a small group of folks, and then we get to all dive in deep together. In fact, tomorrow night, we are doing our live learning session on functional seizures with PT and psychology. This, by the way, I already looked at the slides, looks amazing. We're going to talk interoception, the sensory system, autonomic, and all of those pieces. So this is the kind of learning that we do in our Brain Bytes group, and it's for any type of healthcare professional. Somebody asked, what about students? I don't recommend it for students. Somebody else asked, what about new grads? Yes. So somebody who's a new grad or a residency grad diving in, they didn't get this stuff in school, right? So they didn't talk about F&D maybe, or post-concussion, or hypermobility, or POTS, or how these pieces intersect. What about complex dizziness? No, they just got the basics. So we have had folks that go into practice and go, oh my gosh, I didn't get any of this in school, and want to dive in deeper. So what I want to say though, if you recently graduated or finished a residency, don't pay full price, right? You are just getting started. So we have 50% off for you. So send me a message and I'll send you a link for that. Do not pay full price for anything that we do at Re+active. I care way too much about our students and new grads and residency grads. I've been through all of it. Get 50% off. So just send me a message if you're a clinician for that. The other thing is we've had these bonuses. So yesterday we dropped a bonus. People who sign up get our dystonia mini course. So if you signed up by yesterday, everybody gets that dystonia mini course. Today we dropped a bonus, and I am more excited about this than anything else, which is for a masterclass with our friends Jamie and Catherine. They're a dizziness duo. They are amazing neurotherapists, vestibular therapists, and they're doing a class for us, a masterclass on visual motion hypersensitivity. They're going to do a live assessment and treatment of this. It's going to be awesome. And this is a bonus we just added today, and it's only good for today. So you have to sign up by 9 a.m. tomorrow to get that bonus. So if you're a clinician who's been on the fence, get the things for sure. Another question, psychology. So somebody asked about this as well. So our psychology team is also part of Brain Bytes. So they're mentoring other clinicians within Brain Bytes. And someone asked if our psychologists do consultations with other clinicians all in other states. And yes, they do. So if you are a clinician in another state, you can do mentoring or consultation with any of our team, any of our psychologists, and we have neuropsychologists, rehab psychologists who are experts in this field, and any of our PTs and OTs as well. So that is something that we've been doing with people all over the world. And I want to remind folks, if you're a Brain Bytes member, you actually get not $20 off, it's like $50 off, but 20% off of those consultations. So if you're a part of Brain Bytes, but you want to do some one-on-one stuff, you get 20% off of those. And again, you can send me a request for that. I'll send you a link to sign up for those consultations. Those were the questions that got sent to me today. Somebody else has said, do you prescribe medications at your clinic for patients, or is that not an option? Great question. So no, we're actually not medical doctors. So I have my doctorate in physical therapy. Our OT has his doctorate in OT. Our neuropsychologist has her doctor of psychology. Our rehab psychologist has his PhD. None of us are physicians that are medical doctors that prescribe medication. Now, I'm not anti-medication, and so we work with physicians and neurologists and movement disorder specialists that if somebody needs medication, we're chatting right with that physician to figure out what they need or an adjustment. So a lot of times we're looking at adjusting medications, and because the person spends so much time with us, we're kind of collaborating on that with their neurologist. But we don't make those decisions. That's not part of our practice. So that is a very, very good question. Do neuropsychologists see patients internationally? Really good question. They would love to, but they are not able to see patients internationally. So our neuropsychologist sees patients only in California at this point. We are actually applying for licensure in Texas. I think I had mentioned that we have a physical therapist that's licensed in Texas. We have a physical therapist that's licensed in Florida, and we're looking to expand our OT and psychology team to treat out of state as well, because there's just a need. There's a need for this kind of care all over the world. So great question. But right now, internationally, only our physical therapists and occupational therapists can work with people out of internationally. And that's just with some of the licensing and requirements for the other professions. So thank you for asking that question. And it brings up kind of a general question that I get all of the time, which is what is available for patients? And right now, some of the things that we've been growing and just, oh my gosh, it's been overwhelming to me how impactful it's been, is an online membership. So we have three actually. I'll do the three online memberships. One for people with Parkinson's, and these folks have a whole array of Parkinson's specific exercise, yoga, and education classes every single week. It's awesome. And then there's an online community to talk to each other and talk to our team. And then we have an F&D membership. This is for people with functional neurologic disorders. And there's a whole slew of There's an education class led by our PT/OT psychology team. There's a workshop group every month led by our psychology team. There is yoga. There's a dysautonomia exercise class and a balance class and a functional fitness class, all open for people with functional neurologic disorders. But maybe the best part is the online community. This is where people come together, they support each other, they encourage each other, they answer questions. Our team is in there every day. It's awesome. So we have those two memberships. And then we have an online membership for people with neurologic disorders. This is where we're hosting our new dystonia education class that is starting in a couple of weeks. So if you have dystonia, definitely send me a message if you want to get in on this education class. Basically, you join our unlimited online membership and you can come to the dystonia education class every single week. You can also do our adapted yoga class. It's adapted for people with dystonia and led by our occupational therapists. You can do our exercise classes, everything geared toward people with neurologic disorders. So those 3 online memberships are really, really great for folks that maybe can't get out to California for things, which not everybody can. So those memberships are a really great resource for you. And then again, if you're in California or want to come to California, you can do a whole integrated program with us, and we can do online therapy if you're international. So I think that got to all of the questions. I'm just going to make sure I didn't miss anything. I think we got it. So to wrap it up, we talked frequently asked question about a functional tremor, and I shared a lot of ideas outside of motor control that you can use. We talked about a frequently asked question for heart rate variability, and I talked about both the leaf and the polar H10 as options, how we use them both in therapy and how we give them or have people use them at home to give them some feedback about their heart rate variability. We talked about brain bites. If you're a clinician, our doors close tomorrow, and that incredible bonus for the visual motion sensitivity, visual motion hypersensitivity masterclass. It expires at 9 a.m. tomorrow morning, and then our doors close tomorrow as well. And then we talked about all the different ways that you can join us and get the support and care that you need if you have a neurologic disorder or chronic condition. So thank you. Thank you so much for being here. Thanks for being a part of this community. Thanks for being so curious and caring about the brain and body, about your patients, about yourself. Yeah, Chris, thank you for the great question. You're not the only one, so that's why I had to do a live on it. Thank you so much. I hope to see you as a clinician in Brain Bites so that we can continue these conversations. And gosh, if you're a patient, I hope to see you in our communities too. And awesome. Hey, Casey says, I've been watching on Chris's phone, but wanted to sign in and say thanks. Oh my gosh, that is so great. You're so welcome. Let's stay in touch. Let's stay connected, and hope to see you soon. Have a good night.